Hello and welcome back. My name is Tracy Rogers and I'm here with Karline Brathwaite, and we are talking about adolescent health, a call to action. So first segment we talked a lot about what are some of the issues and challenges that adolescents are facing in this generation that we weren't facing in the last generation. And we talked a lot about the statistics and the information we have about the challenges that our young people are dealing with, from self-harm, suicidality,
depressive disorders, anxiety, and behavioral disorders, behavioral challenges.
So we have a problem.
Yeah.
So we know that positive adolescent health outcomes are possible, and a lot of these challenges are preventable. So today we are talking about what are some things that parents can do, adults can do,
Yes.
to really change the outcomes that we're seeing.
Yes. One of the first things, information. A lot of parents, while what they are doing works, can be supported by access to information, especially when it comes to things like developmental disorders, children who are being raised now with challenges with attention disorders. Just getting information, knowing how to, one, cope with it as a parent, and how to help your son or daughter cope with this challenge. The information is accessible, and getting skills in parenting doesn't make you less of a parent. It doesn't make you unfit.
And it's very accessible.
Yes.
There's so much that you can learn online about parenting.
Yeah.
So I always tell people, when you're going online, I want to caution you. Because sometimes when you're reading up about things that could go wrong, you can go a little crazy.
And you get overwhelmed.
And you can easily become overwhelmed. But it's a really good place to go to for ways in which to get really practical advice about how to improve some of the situations you're dealing with. So getting informed as a parent, that's your first line of defense. Read, don't assume that you know what's going on with this generation.
Yeah. One other thing too is psychosocial support for your son or daughter. And what that really means is, one, getting your child engaged in activities that can, one, build skills, build coping mechanism, build the communication skills to help them, one, manage themselves, as well as to help them grow healthily and to grow in the midst of this challenge. That in itself also doesn't mean that your child is crazy or your child is sick. It just means that you as a parent now taking responsibility and, one, empowering your child to, one, take care of themselves and to be able to manage themselves in the school, manage themselves at home.
I like this point too, because a lot of times, so therapy and doing therapeutic work when a problem arises could be really useful.
Yes.
We talked about going to the internet and being overwhelmed. Sometimes you need a professional, someone who is really knowledgeable about the literature and can pull things apart for you and give you that one-on-one guidance. But therapy can also be proactive. And so I love this idea of getting involved in therapeutic skills, therapeutic training work, so that you're building coping skills. So your child is not necessarily showing up with a problem just yet, but before that we're talking about how to do adaptive coping. We're talking about building healthy sense of self, and we can do a lot of that through group therapy. So that's really, really important, that you can use therapy in a preventative way instead of just to address a problem that arises.
Absolutely. And Tracy, another thing too is something that I like to call intentional caregiving.
I like me some intentional caregiving.
Our busy schedules, parents who are running single parent homes, and time may be limited, children who are out in all of these different groups, and unfortunately we don't get enough time with each other at home. And so what intentional caregiving is that we sit down and we create opportunities to engage healthily and intentionally with our children. We make that time, if it's a Sunday evening or before we go to bed at night, but we don't just wait for it to happen, but as parents we take that responsibility and we engage with our child intentionally.
Because if we have that relationship and we have that space for intentional caregiving, when I have a problem I have a time to tell you.
Absolutely.
Whereas if I don't have that space, I'm less inclined. So when we create that space for intentional caregiving, we're also creating rapport and comfort with rapport.
Absolutely.
So that is relationship building. Sometimes when we have our teenagers, we find ourselves, what wrong? Talk to me. Like if I'm talking to you all the time, even if I know mommy and daddy's going to annoy me twice a week for an hour, and it's part of the ritual. It's part of what we do.
And you're more likely to pick up on some of the signs or risk factors for things like suicide or depressive disorders. We can see there's shifts in behavior. So that intentional caregiving is very, very important.
Yeah. And then looking out for the signs.
Yes. So that's the other thing too. When we get information, we can know what to look for, what to be aware of. And there are always signs when it comes to suicidal behavior. We think that, when someone wants to kill themselves, they're going to, but unfortunately that is not true. Things like risk factors for things like depression, when people begin to withdraw, when your children, you find that they're not communicating, all of a sudden they're unable to communicate, and when you do see signs on their bodies of self-harm,
isolating behaviors.
Exactly. Even
in their room all the time.
Yes.
Constantly sleeping. A lot of times people don't know that sleeping is a great way to numb.
Yeah.
If I go to sleep, I don't have to deal with the world.
Yes.
But all of that is affecting our biochemistry,
Yes.
is affecting our brains, is affecting our moods, and it's pushing us closer and closer to be more withdrawn.
Exactly. Substance misuse is another thing too.
Right.
That we can also be aware of. And all of these are signs of potential suicidal behavior and other mental health challenges that can be happening with our children.
So I feel like this is such an information-packed segment. I want to thank you so much, Karline, for bringing this to us here. I want to encourage you out there that if you are parenting an adolescent, that we want to really encourage you to take action, to be proactive, and recall that many of the challenges that they deal with are preventable.
Yes.
Thank you so much for joining us.